Hi, it's Dr. Steve Weiner again from the Panhandle of Florida, and I'm going to talk to you about a topic that was brought up in Injector's Lounge by Dr. Subio. It has to do with static lines in the glabella and how do you treat them. So static lines are lines that appear at rest. Neuromodulators such as Dysport and Botox are used to treat the dynamic lines, the lines that appear with movement. So they range from none to severe. And what treatment options are there? They're neuromodulators, they're fillers, and there's threads, okay? The higher incidence of vascular occlusion in the glabella, and that has to be considered. There's also a higher risk of having blindness because of its proximity to the vessels that supply the eye. So the supratrochlear artery is usually deep in this area, but occasionally it could be 1 or 2 millimeters, which is very shallow. So I go back to this paper, and this paper was really enlightening. This was done by Carruthers and Fagien in 2016. Okay, and what they did is they reviewed a previous study that they had done with Botox, and they looked at the static lines in these patients. And what they found is that they had 225 patients that had a score of 1 or higher. That means mild, moderate, or severe static glabella lines. All had 3 injections at 4-month intervals. So this is very interesting in what they found. So they found that the more treatment, the better response, obviously. The older patients were more responsive to repeated treatment. So this is the older line. So as you see, as you get 1 treatment, 2 treatments, 3 treatment, it keeps increasing. So the more treatments the older patient gets, the better these static lines become. You can also see that the younger females responded very quickly. They're well over 80%, but they didn't respond much differently after the second or the third. So this line is all severity, and you see that they responded at around 50% on their first treatment and up to around 60% by their third treatment. So all comers did respond to neuromodulators after 3 times. So this is an interesting graph, and I have to kind of explain it to you. So basically 1 means responding, 0 means they didn't respond. And so this is responders 1 or greater at rest. So this is everyone. And so this is what I was just alluding to. So around 55% respond after the first treatment. So then you go to the second treatment, and you have some that didn't respond to the first treatment, which was a 0, and you had some that responded to the second treatment, which was a 1. So these are patients that responded to the second treatment, these orange-ish patients. This patient responded to the first one, but not the second one. And totally gray didn't respond at all. So you see that it's gradually increasing. And by the third, you have some that responded to some of the treatment and some that didn't respond to them. But basically, you get increasing responsive rates as you go on. So now we're comparing the 1 or greater at baseline, all comers, versus just the mild ones. And you see the mild ones even respond better. So that's the gist of this graph, is that you have many more responders when they start out at mild than when you take all the comers, which are mild, moderate, and severe. So this is the explanation they came up with to explain why repeated doses of neuromodulator improve these static lines. For a fact, they said, neuromodulators increase the skin pliability and elastic recoil. They have proven that. Chronic stress of repeated skin folding on skin is alleviated when you give them the neuromodulators, thus strengthening the collagen and elastin fibers. Take a piece of paper and you keep moving it, keep moving it, keep moving it. Even when you relax it, you see that fold because it's very weakened. When you don't keep moving it, it will strengthen because the collagen fibers will strengthen in that area. This would explain why repeated treatments are better. Now they have some other explanation as well, which is pretty complex. C-terminal binding domain region of the botulinum toxin is homologous to fibroblast growth factors, making this complex similar to fibroblast growth factors. So to summarize this last explanation, basically there's some type of fibroblast stimulation that occurs with these neuromodulators. So the additional findings, the smoothing effect on resting lines may last longer than the dynamic line improvement. And that might explain why satisfaction scores are still elevated even after return of muscle function. And that was found in the DREAM study as well by Disport. So how do I personally treat static glabellar lines? Well, as our study has shown, I treat at least 3 times with neuromodulators. If you're still not satisfied with the result, then I go to lasers or RF microneedling if the line is not that deep. If the line is deep, unfortunately, the only way to fix that is using fillers. And I try to put the fillers into the dermis, which is the safest area in the glabella, in my opinion, if you know you're in the dermis. If you don't know you're in the dermis, don't inject in this area. I know that Dr. Lonnie Van Logem, he will inject very deeply in this area using cannulas from above. So that's another option as well, below the galea. So thanks for listening. Dr. Weiner signing off.